Hi, my name is Avani Shah. I'm assistant professor in the School of Social Work at the University of Alabama, and today I'm going to be talking to you about my Hartford Faculty Scholars research project, Motivational Interviewing and Self-Administered Cognitive Behavioral Therapy to Address Depressive Symptoms and Medical Compliance in Cardiac Rehabilitation Patients. Before I begin, I would like to give a special thanks to the Hartford Foundation for funding my research and to the DCH, Cardiac Rehabilitation Program, for helping me to actually conduct the research, and the University of Alabama School of Social Work for supporting me as I do this research. Thank you so much. The background behind this is that after a cardiac event, a number of people experience depressive symptoms. The depressive symptoms are related to poor medical compliance, which in turn is related to poor health outcomes. So the purpose of my research is to provide an intervention that targets both depression and health behaviors. The way I'm doing this is by combining two treatments, cognitive behavioral therapy and motivational interviewing. Cognitive behavioral therapy targets negative, dysfunctional thinking as well as behaviors that contribute to depression. The goal of the cognitive behavioral therapy intervention piece is to help people change those ways of thinking and increase pleasant activities. The way this is going to be done in this particular treatment is people will be provided with a self-administered cognitive behavioral therapy audio program that's on an MP3 player, as well as a workbook. They'll use that on their own in the comfort of their home to learn ways of changing their thoughts and improve their mood. The other component of this is a motivational interviewing teleconference group that meets weekly for 1 hour. During this group, older adults will have the opportunity to learn from one another and support one another as they make changes and modify their behaviors in diet, exercise, and smoking. The aim of this research is to evaluate the implementation of this combined treatment and to identify if this is the sample size that would be needed for this type of research. In addition, I would like to develop a motivational interviewing treatment manual that can be applied throughout other cardiac rehab programs. And we're going to be using a randomized controlled clinical trial to evaluate the performance of this particular treatment modality. We're going to be randomizing individuals after they've screened eligible, completed an informed consent, baseline assessment, and then they would be either randomized to a telephone monitoring group or to this combined intervention group. Those who are in the combined intervention group will receive a little bit of training on how to use the MP3 player, and then for 9 weeks they'll participate in the teleconference group, listen to the audio program, and receive weekly contact telephone calls. The other group would only receive the weekly telephone contact calls, and thereby at the treatment, at post-treatment, they would complete some additional forms, and we would be able to evaluate if there were changes from before they started the treatment to after they completed the treatment. And this is basically the crux of the study. Hopefully, by evaluating this type of intervention, we will be able to create a low-cost intervention that could be applied across cardiac rehab programs if it's found to be successful.